This webcast will provide an introduction to Smart Assistive technology. It will do this by first defining Smart Assistive technology, then providing a brief explanation on how these work. But the focus of the webcast will be on covering the functions of Smart Assistive technology currently available so that you can start to think about how they can assist you. Technologies covered in this webcast were selected based on the definition of Smart Assistive technology as having one or more of the following four features. Firstly, sensitive. So using sensors or a range of mechanisms to gather information in the environment. Mobile. The ability for carers or users to move freely and easily in locations remote from where that device is functioning. Autonomous. Some of these can operate autonomously, similar to home automation systems, by following schedules or scenes created for the user. Responsive. Some of these can act on the environment where the control device is. This occurs in response to one or more of the above triggers, either a sensor, mobile user, or automated schedule. And finally, these are technologies. They vary greatly in how they do this, although in the simplest form, a device collects information from the environment and a response is activated which acts on that environment. This can occur within the home environment or it can occur in the wider community. That sensed information can be sent via the phone line or via internet connection to a call centre. This information can be sent to the cloud or web for analysis and retrieval by anyone who has been provided with the password. Smart assistive technologies can either be dedicated assistive technologies or mainstream assistive technologies. The difference between these are dedicated assistive technology is designed primarily for people with disabilities to use, versus mainstream technologies, which are designed for the general population, although these can become assistive technologies when they are required by a user with a disability to enable them to complete a task or to improve the safety or ease in which they can complete a task. An example of mainstream assistive technology is smartphones and wearables, which you are probably familiar with. Now, these devices have brought with them a lot of different sensors and mobile connection options, such as those listed. Apps can now be downloaded onto these devices and provide assistive technology functions for people. Another benefit of the advances in the mainstream technologies is that dedicated assistive devices is also getting a boost, as there's more options emerging in these areas, and this is providing people with more functionality than ever before. For the purpose of understanding smart assistive technologies and what functions are possible within these, we've categorized smart assistive technologies that are going to be covered in today's webcast into 5 categories. These categories are based on the function that these devices provide, and I'm going to step through each one of these now. The first category is home control and security. Door locks either use fingerprint recognition as the key or proximity of a smartphone as the key to let the user in. Doorbells can be used to notify a user of the doorbell that a visitor is at their front door, so that that user can communicate through two-way voice communication between the person at the front door and their smartphone. Smart cameras. This allows a user to log in and view camera footage in real time. They can also communicate through two-way voice communication. Electrical outlets and lights. These can both be controlled via smartphone or tablet apps or through internet-connected devices. Home automation can be used by most of these devices discussed already to schedule timed events or for a user to be notified via text message or email of device use within the home, In some cases, these can also allow remote control of in-home devices. The second category are automated appliances. So these are things like air conditioner units, which you can control using a smartphone application or through internet accessible devices. You can also create schedules and autonomous rules for these air conditioners. White goods, these are things like fridges, microwaves or ovens, or washing machines. And you can actually monitor their functioning from a remote location. In some circumstances, you can actually control the device from a remote location, such as turning on a washing machine. Smart televisions, so these allow you to access the internet through the television, and you can download applications onto these which can provide assistive technology features and functions. Cleaners and lawnmowers. You can get robotic vacuum cleaners and robotic lawnmowers, which will clean your floors or mow your yard. The third category are safety monitoring devices. Traditionally, these are emergency call systems. These can also be called personal response systems, and there's Australian standards that relate to these. They define these systems as communication systems that facilitate the connection of the user requiring assistance to a central monitoring facility. These are for persons at risk and must have a voluntary alert option. Additional continuous sensors can also be used within these systems. Additional sensor options are things like fall detectors, which can automatically detect if the user has fallen over and raise an alert. Seizure detectors, which monitor movement-based seizures and can raise an alert when these are sensed. Activity or inactivity monitoring devices. These work by monitoring movement of people or items within an environment. These can trigger alerts if movement occurs or if no movement occurs. These are set by programming. Environmental monitoring options are things like flood detectors, gas detectors, and smoke alarms that can be linked into these emergency call systems. GPS tracking devices or location tracking devices allow the user's location to be identified and sent to emergency contact. An additional feature of these devices can be things like communication, so some of them can allow two-way communication, or geofencing, so if the person actually moves outside a preset safe zone, an emergency contact can be notified. Or speed limits can be defined. So if a person exceeds a certain speed limit, which might indicate they're in a vehicle, a user can be notified. The fourth category is health management devices. These are things like medical monitoring devices, which collect someone's vital signs, such as but not limited to things like blood pressure, blood glucose, and temperature. They can also record questionnaires. This information is either transmitted to a nurse for review and action, or becomes available on an online portal. TGA approval is required for medical health monitoring devices. These are defined as devices used for the purpose of diagnosing, preventing, monitoring, treating, or alleviating an injury, disability, or a disease. These provide a solution for self-management or augment medical care. These include things like vital signs or chronic condition management tools. Health and wellness promotion devices assist in tracking health data for the purpose of engaging consumers and motivating them to improve their health. These can be things that are worn, such as exercise trackers, or they can be apps. Medication dispensers are available. They can prompt users to take medication or provide a visual indicator for the medication that needs to be taken. These can also, in some circumstances, physically dispense the medication which is due to be taken. Some of these systems can send alerts remotely to carers if medications are not taken. It's important to involve a pharmacist in the process of recommending one of these items. Care management systems can be used by carers to coordinate the care of someone. This is predominantly done through a shared calendar system, where tasks that an individual requires assistance with are listed and then people are assigned to these tasks. The users can also write notes related to that individual's needs or the progress. The final category that I'll cover today is activity enablement. The functions of these devices vary greatly. These include mobility or movement devices. These are things like tremor cancelling cutlery or a Parkinson's step length prompter. Stress or pain management devices used to track someone's stress or pain or provide a distraction. Navigation options. These can provide an auditory or a vibration feedback for someone who may have a vision impairment and assist them to navigate their environment. Sense augmentation devices. These are things that help someone with a vision or hearing impairment to better manage and complete activities within their environment, such as a reading aid, hearing aid, or magnification options. Schedules. Schedules actually list tasks which need to be completed. Prompts. Prompts actually break tasks down into smaller, more manageable steps. They can also provide real-time feedback within an environment, such as a motion detector which signals a message, such as "don't forget your keys," or a smoke alarm which provides verbal direction of someone rather than an auditory alarm.